We'll move right along on the program, and we're going to spend a little bit of time here with a panel that's going to be talking about Obamacare. Of course, this is an issue that I think we've discussed at each and every one of the Red State gatherings, which is an indication of the fact that this sad piece of legislation has been a long-running feature of our country and our economy, and still proposes a perplexing problem in terms of how we're going to deal with it. So our next panel is going to tackle some of those difficult questions. And on the panel, we have Matt Bellis of the group Liberty Healthshare. They are one of our sponsors of this event. They have a booth out there in the back. Please go check out the booth. They'll give you an awesome thing that looks like a pen. It's got a squirt on the end. It is not mouth spray. Don't find that out the hard way. It is to clean your hands with. It's got alcohol in there. But go check them out. They've got good work. So Matt Bellis is here from Liberty Healthshare. We also have my colleague Katie Pavlich from Town Hall. And we also have Ed Morrissey from Hot Air going to be on the panel. They're going to talk about Obamacare. What do we do about it now? What are the free market solutions that are possible in this day and age? Just give them a hand.
Thanks, Leon. Good afternoon, Red State gatherers. Is that a real thing? Thank you so much for coming to Denver if you're local, and especially if you are not local. We appreciate you spending your time with us this afternoon and for the weekend. So we're going to talk today about conservative alternatives to Obamacare and free market solutions. So as Paul Ryan said earlier this summer, this is the 6th year in which we've been talking about repealing Obamacare. And Ed, I want to start with you. None of us can escape the current election environment. Why aren't we hearing about this on the campaign trail, and should we be talking more about it?
Well, I think we do hear about it on the campaign trail from the Republicans. I know Donald Trump has mentioned it a few times. I don't think that we're mentioning it enough, anywhere near enough, especially because we are rapidly approaching a crisis point with Obamacare. The Hill, in fact, even mentioned this, is that the next president, whoever the next president is probably going to have to deal with a crisis in Obamacare within the first month of their presidency, regardless of who it is. Insurers are dropping out of these exchanges. The premiums are going up for the 4th year in a row. More and more people are opting to just pay the fine. And so the utilization rates are off the charts, and insurers just cannot get a grip on how to keep the costs under control, which was the whole point of this, supposedly, was to control costs. So this is something that is an imminent crisis and really should be a focal part of this presidential campaign. It does get mentioned, but nowhere near enough.
Well, I guess my question then would be, one of the big arguments that Republicans have made, Matt, and I'll go to you, is that it's okay that we have Obamacare because eventually it will just collapse on its own. Has that panned out well?
Politically, I wouldn't say that the idea of setting up a system so it can fail and knock people out and then government swoops in and tries to be the savior is not a new strategy. I don't know if Obamacare will go away politically, but I do know that there are things that you can do today to exempt yourself. And as someone who is tried and true a capitalist and somebody who believes in the free market, there are things that you as individuals can do to make sure that you are not a part of a collapsing system. Because I believe, we all know, it's probably doomed to fail, right? I don't think that we would see a lot of answers coming from DC on this.
So on that note, Republicans have been criticized a lot for not stopping Obamacare, not doing enough to stop Obamacare. The House has voted more than 60 times to repeal Obamacare. Paul Ryan introduced a new plan for a replacement to Obamacare at AEI in June of this year, keeping some of what Obamacare has to offer, but also arguing that giving back patients' choice and reopening networks and that kind of thing. You, Matt, just mentioned that we shouldn't be seeking answers from DC. So I guess my question is, when people criticize Republicans for not doing enough, are they searching in the wrong place for an answer to solving this problem?
Short answer, yes. Long answer is absolutely.
Well, we have the time, so if you want to expound on the long answer, go for it.
Good night, folks. It's been great.
Yeah, thanks, everybody. No, It is sad to me, as an entrepreneur and somebody who has built up a business around the healthcare industry, it is sad to me whenever I see people who profess to believe in what capitalism stands for and what the free market can do, yet they wait on central planners to make those decisions for them.
Right.
And so as, you know, in this world that we are in now, you know, as Liberty Healthshare grew up, we grew up inside of the world of the ACA. It was there when we kind of reformulated a smaller healthcare sharing ministry and grew it. There are things that we can do in today's world, hint, hint, join a healthcare sharing ministry, to exempt yourself from the Affordable Care Act and forget what DC says.
Yeah, we're going to get into some solutions and what you guys can do moving forward to exempt yourselves from this collapsing Obamacare mess. But Ed, we're in Colorado.
Right.
We're seeing Obamacare collapse before our eyes. You want to expand a little bit about the details, not only just in Colorado, but in states across the country that we've seen try to participate in Obamacare, setting up their exchanges, failing, and now owing taxpayers millions, if not billions of dollars.
Right. There's actually been several aspects of this that have failed. And the first thing that failed, of course, were the exchanges themselves in states like Oregon and other states that, Minnesota, my home state, had a terrible time trying to get an exchange up and running. And bear in mind, folks, that this is the same basic function that the insurance companies themselves have been doing for years. Online portals for signing up for insurance coverage. This was not reinventing the wheel, or at least it wasn't supposed to be reinventing the wheel.
Exactly, yeah.
This was something that was a fairly well done task that people had already been doing for some time. In fact, the Medicare Advantage program used a very similar sort of portal and works just fine. So there was that aspect of the failure. The more recent failures have to do with the inability to predict the utilization rates in a system that's designed to force everybody into the system, but which has not done that. And the canary in the coal mine, if you will, has been the federal co-ops, the federally subsidized co-ops. We started off with 23 of them. I think we have 8 still left, and I think half of those are not expected to last into 2017. The federally subsidized co-ops were the replacement for the public option. How many people remember the public option from the Obamacare debate? Maybe not too many remember this, but 6 years ago, or 7 years ago, when Democrats first were putting together Obamacare, they wanted the public option. And the public option was basically a state-run Medicare program, if you will. It was a government payer program. And that got defeated. Conservatives did manage to stop that from going forward. And the whole idea of that program was to undercut the prices of the insurers. And the excuse was, well, we want to give people an affordable option in the marketplaces. But what it was going to do in reality was going to undercut prices so much on premiums that people would run away from the insurers. They'd sign up for these plans, which would have to be subsidized at tremendously high rates. That got thrown out. They put in the co-ops. The co-ops are basically operated in the same sort of manner, and at least for the first year or two, thought they were going to get unlimited funds to backstop their losses. Well, that changed in the one of the actual wins that we got in the budget deal was to cut that off, and the monies that could be used to subsidize the losses were restricted to taxes that were raised through the Obamacare, through the Affordable Care Act, which effectively bankrupted the co-ops. It will effectively bankrupt all 23 of them eventually. More than half of them are gone now. So what that meant, what that showed was that government payer or single payer is going to be kind of a disaster. It's going to run rich in red ink. Taxpayers will have to keep paying higher and higher taxes to try to fund fewer and fewer benefits and fewer and fewer providers. Now, the reason why Katie brings up Colorado is because here in Colorado, how many people are from Colorado? Oh, okay, great. So Amendment 69, you guys know what Amendment 69 is? How do you feel about Amendment 69? Well, you're the smart ones. So you guys are the smart ones, because the Colorado Health Institute just released a report on Monday that this is a nonprofit, non-aligned group that did an extensive analysis of Colorado, is it called Colorado Care? It would be called Colorado Care, right? Colorado Care, if Amendment 69 passes. And it was promised that it would save money, that it would actually reduce the amount of resources that were going into Colorado healthcare by instituting a state-run single-payer system here in Colorado. Well, what CHI found was that it runs a $258 million deficit in the first year and just gets worse from there. By the time you get to year 10 on Colorado Care, how many people know what the deficit is going to be on Colorado Care? How many of you have heard about this analysis? Somebody says $1 billion. Anybody? Do I get a higher bid than $1 billion? $1 billion, $2 billion, $2 billion, $2 billion. What was that? $7.8 billion in the red. That gentleman right there has just bought it. There you go. Thank you, sir. So the idea that a single-payer system is the inevitable result of an Obamacare collapse, there may be some truth to that politically, but economically it would be a disaster. And that is what we are discovering right now.
Did I read correctly about the whole Colorado Care thing, that it would actually be run by a privately funded nonprofit, that the citizens of Colorado necessarily don't get any say about who is actually running that?
That is correct. Yeah.
That is correct. Yeah.
That's what I thought. Yeah.
So now that we have that news, fantastic. Matt, I want to ask you a question about health insurance companies. Okay. So we keep seeing that these massive insurance companies are pulling out of Obamacare because it's too expensive for them to stay in. They've somewhat been treated as the victims in the last 6 years of Obamacare. Can you explain a little bit about the history of insurance companies being in bed with big government and benefiting, especially when it comes to Obamacare, and how, as more rural hospitals close, how networks narrow, how do we handle the fallout in a limited government, conservative way, away from even maybe the insurance companies themselves?
Okay, there's a lot to unpack there, so bear with me here. Is anybody familiar with the history of insurance and government as collusion in terms of what happened with HMOs and it's snowballing from there? I'm seeing a hand back there. Yes. Okay. By the way, I was raised in a church, so if I say a hand back there, you just got saved. So anyway, but the whole environment of a third-party payer system that was developed within government and insurance companies. It's kind of like the perfect storm of corporate cronyism and government. Especially, it's kind of full on display now as we see in these days. But we have seen what can happen whenever you have private organizations and public companies and what they do to a particular industry when it comes to having price inflation, when it comes to having fewer choices. It's just kind of bad all around. And it starts in an era where necessarily paying for healthcare wasn't really broken, but the government was just going to do a little touch and just make it a little bit better for you. I don't know if that sounds familiar to you.
We're from the government and we're here to help.
Yeah, right. Just a light touch, you know. That kind of stuff just snowballs from there, and we're at this place right now where we're saying, you know, nationwide, it may not be on the campaign trail, but we're saying, what are we going to do about healthcare costs? And I would have to say not a whole lot of people are aware of what the healthcare costs actually are. Because you go to the hospital and you don't necessarily pay a fee for service. You go in, they say, you know, oh, we're going to do this, this, and this to you. If you had the foresight to say, what is this going to cost me? Do you know what they're going to say to you? We're just going to do it, and we're going to bill it to the insurance company. So then that increases cost, which decreases choice, which what Katie pointed out is the end result in terms of limited opportunity. We have a lot of hospitals that are closing down in rural areas. Any rural area folks here as well? Okay. I don't know if you've all seen that, but that also limits the choice of where people can go. And if that hospital was a part of their insurance program's network, then where do these people go? You know, so this whole situation where we've had, you know, these, and you can debate me on this, well-intentioned ideals to try and bring healthcare down and in terms of cost and access, we're seeing full on display that that's not the answer. So.
And Ed, to kind of bounce off of that point of bringing down actual costs, I mean, the left has portrayed Obamacare as bringing down costs for everyone, which has been completely the opposite, as I'm sure every person in this room knows, based on their premiums going up every year. And open enrollment is soon, so get ready for another rate hike, which is exciting. But there's a difference between actual costs going down when you're paying for healthcare and paying for costly healthcare with insurance. So explain the difference in how we can get to the part of actually bringing down costs for healthcare services rather than bringing down the cost of insurance.
To put it simply, there's a difference between price and cost. And what Obamacare has tried to do is try to artificially lower the price without dealing with what the underlying costs are. And that's when you end up going into rationing systems. That's when you start having your choices limited. That's when government becomes more and more and more an imposition on the market. In order to understand how costs work in a healthcare market, take a look at two industries that, by and large, insurance industries don't cover. You have LASIK, and you have elective cosmetic surgery. And because there are some types of cosmetic surgery that insurance does cover for reconstructive purposes, and because there's certain pathologies that require it. But for the most part, elective cosmetic surgery is not covered by insurance, so it is an entirely retail experience. Same thing with LASIK. So what do you see in these markets? Well, first off, you see a lot of advertising. You see a lot more competition. The providers in these markets don't have to go through a third party to get paid, and you don't go through a third party to get the service. So what you see is consumers get full price signaling on whatever these procedures are. They get an opportunity to do price comparisons as well as quality comparisons. You have private industry boards which will certify whether or not a provider it meets the minimum requirements for safety and professionalism. And you get an opportunity to make a choice between all these different things. And so when the demand goes up, more people come in to fill the role of providers in order to meet the demand, because there isn't that many barriers to entering that market. When the demand goes down, of course, the number of providers will go down, and we've seen a little bit of that in the LASIK and in the cosmetic surgery market, just because the demand has dropped off. But that's a healthy market. That is actually the sign of a healthy market. You have supply and demand meeting each other. Price signaling allows you to go out and compete, and that's exactly what you don't have in the rest of the market, because you have insurance being insurance filling a role that insurance was never meant to fill. Insurance is indemnification against unforeseen and unplanned events in your life. What insurance has turned into, in the health insurance model, is basically a health management organization. And that's the reason why we have ceded so much of our power as consumers, and providers have ceded so much of their power as providers to these insurance companies. And I share your opinion on the insurers. The insurers were not victims of Obamacare. They were the driving force behind Obamacare. They're getting burned now, but that's more irony and justice than it is victimhood.
Oopsies.
Yeah.
As Ed said before the panel, they made a bet, and it did not pan out for them.
No.
I want to talk to Matt about Liberty Healthshare now, because we've talked about the problems with government intervention, the collusion between big health insurance companies and the government, how people like us suffer as a result of that. Talk about Liberty HealthShare, what it is, and talk about why it's important for people in times of uncertainty to still pursue entrepreneurial projects, especially in the healthcare field.
Okay. Liberty HealthShare is what's considered in the law and specifically a healthcare sharing ministry. Do we have any members of healthcare sharing ministries here? Is that anybody?
Oh, it's somebody over there.
There? Oh, okay, all right. Okay. So healthcare sharing ministries, if you wouldn't mind me so humbly saying, is the answer to what ails us right now. It is a group of people who voluntarily join together to help each other pay off their medical costs. Think of it kind of like crowdfunding. Familiar with things like GoFundMe or things like that? What Liberty HealthShare does is we make that a very effective, efficient, and reliable system to help pay for your medical costs. So what we do is we line up your needs or your share amounts with somebody else who has a share amount or a need. And so basically it is just self-pay patients who have commonly held values who will say to one another, whenever you're in need, I will help you pay for your medical expenses. So that's basically it. There's a lot more to that, and I would definitely say you might want to look into it. But when it comes to healthcare sharing ministries, that is a response. Just as we were talking about in terms of economics in the healthcare market, it's a response to what is out there in the economy today. We have seen in the healthcare sharing ministry industry, we have seen an explosion of growth. Liberty HealthShare by itself has grown in the past year 500%. I'm not going to lie to you, that's a lot. And it taxes our systems, to be honest with you, and we are always trying to improve. But with that growth, that is a response to a market need that says, I want, as a patient, to be put back in control of my health care. I want my doctor to not have to cater to a third-party payment system. And I want to be in the driver's seat with my doctor so that I'm getting the best care that I can. And whenever I have, thank you very much, feel free. I hear that, amen.
Amen.
But that's who and what we are. We're here to empower patients, to put them back in charge of their own health care. And that was a market response to a need that was out there in the world today. Liberty HealthShare is a reformulation of another healthcare sharing ministry, a smaller community called the Gospel Light Mennonite Church Medical Aid Plan, Inc., and we changed it. So, but Liberty HealthShare was born in 2013. We have grown it up to where it is now today. We're in all 50 states, and we are one of the leading healthcare sharing ministries out there today. So. Yeah.
One of the things that I think is really interesting about Liberty HealthShare is that they started, as you just said, in 2013, which was after Obamacare was implemented, when the market seemed like it was going to be monopolized by Obamacare, that the free market had been shut out, and yet here you are making a big difference in giving people back control over their medical decisions.
We started Liberty HealthShare in the cab of a car hauler, frankly. It was myself and my father. We were sitting there talking about what we want to do within the next 5 years. And this was in 2013, and we just kind of, or 2010 actually, and we just kind of looked at each other and said, the ACA's coming up. There's a lot of trepidation out there. People aren't going to know what to do. And we have, as a family, been a part of healthcare sharing ministries in smaller communities out in Ohio and Indiana and Pennsylvania, down in Virginia. And we saw how that system can solve what really ails us as a nation. And so we took that model, ramped it up, made it more effective, more efficient, and tried to bring it out to as many people as possible. But beyond that, not just talking about Liberty HealthShare, what really got me the most as I was kind of thinking about coming here was that it is that entrepreneurial spirit that comes into this country and says, yeah, I see a problem, there's mounting obstacles, but what the heck, I'm going to do it anyway. So I would just say in times like this, these are the times that we need to not wait on what DC is going to do and take that step and really grab hold of what the market has out there and make a success out of it. We have that ability in this room. Each one of you has a wonderful tool that God has given you in the aspect of your mind where you can create solutions to people's problems, voluntarily interact with them, and make a sustainable organization. And that's just fantastic. We don't see that very often in coming out of government. And so it really takes the entrepreneur in times like these to come up with solutions. So a little bit of a challenge to you if you're an entrepreneur out there. If you're waiting on that thing to just be right until you start moving, do not wait.
Make it happen. Be done. Yes,
Absolutely.
Indeed. So I'm going to ask one more question, then we'll actually take questions from the audience, and this one is for Ed.
Okay.
So one of the big arguments against Obamacare before it was pushed through in the middle of the night was that if you offer another entitlement, or in this case, force people into another entitlement, it's going to be very difficult to take it away, even if people feel like it's not the best program for them to be a part of. So now that Obamacare has been implemented for a couple of years, we now have the mandates for individuals to sign up for Obamacare. There are millions of people who are now on this program.
Right.
How do you take that away, or at least convince people to take the leap or the risk into a private program without them feeling like they're going to lose their insurance or not be taken care of?
Well, I think it's a great question. And to tie this back to something that you had said earlier, Katie, it's one of the reasons why the repeal and reform proposals have always been somewhat incremental. Because, believe it or not, politicians respond to price signals as well. They know that it would be very unpopular to just simply repeal it and say, we're going to go back to status quo ante, which was not popular at the time, or we're just not going to do anything at all. So that's the reason why when we see these reform and repeal packages, they tend to be incremental, where they should be a little bit more bold. But it's going to take policymakers to talk past the media, to talk past the scaremongers, and to explain just exactly how unsustainable a model Obamacare is, and even more so, a single-payer system. And thank goodness for Colorado Health Institute, which actually did the study on Amendment 69 and Colorado Care, because all you have to do is read through this very balanced study. They're trying very hard not to take a position, but it becomes very clear that Amendment 69 is completely unsustainable, and it only gives you 3 options when things start going bad, which is to raise taxes, cut benefits, or cut payments to providers. Those are scarcity model approaches. We need to build a model that is built on productivity, that is built on expanding capacity, if you will. And that is how you have to sell this, is that you want more providers to come in. You don't want to limit what providers can make. You want providers to do well. At the same time, you want consumers to have the power to help keep those prices low by providing competition and the price signaling. And look, this is not an easy sell, but nobody said that conservatism or politics was easy. Right. You have to just be committed to it. You have to have good people out there explaining it. And you have to find ways, just to kind of go into a different sort of topic here, you have to tell the stories. You have to know how to tell the stories. So, yes, it will be difficult. Yes, it will take a while. And I think that's, to circle one more time back to your other question, that may be the reason why after a couple of years of trying to repeal this and then losing the 2012 presidential election, that there was a decision, not announced, but sort of a consensus that formed that maybe it was just best to let this thing collapse so that Republicans who were trying to reform the system wouldn't be blamed for the collapse. You know, and there's some logic to that. But unfortunately, what it means is that there's going to be a collapse, and it's going to hurt a lot more people.
Well, and I would argue that if we have a collapse, which it seems like we're going to,
we're moving towards
there has to be a free market solution ready to fill the vacuum when people feel like they don't have anywhere to go to make sure that they're taken care of.
Yeah, and there's a lot of options out there with direct primary care and surgery centers. So
concierge service.
Concierge service.
Yeah.
Yeah. There's a lot of opportunities out there. It's just you got to go find it right now.
Right.
Yeah.
Well, good. All right. Do we have any questions? We have about 5 minutes. You want to come to the microphone?
go to the source and eliminate the tax benefits for employers providing health insurance.
Yeah, that's certainly that's certainly one of the issues. Yeah, I don't know how many people. I'm sure a lot of people here already know this, but the reason why health insurance is so employer-based is World War II. Wage controls in World War II. How many people know that story? Yeah, most people here know that story. But just a brief recap: during World War II, the government controlled wages and locked out wage increases as a way of rationing for a total war effort. There was reasons for it. But what employers then did was start adopting benefit packages in order to be able to compete for workers. So it again tells you that the top-down government control doesn't really last very long. No. And free market solutions will arise around it. And that was one of the free market solutions. Unfortunately, it was an unhealthy one. And we've been in that model ever since. I'm sorry.
I've been in medicine for 40 years. My tool when I started was my stethoscope. The 70s and 80s, we saw incredible tools. Interventional radiology, MRI, all these kind of things. So we saw the costs go up like this.
Yep.
Hillary Clinton was really smart. She saw that this is a tax on business and on the patients. And so she came up with a program. Arrogance. But then we also had Romney that recognized that this was true, and he did something in Massachusetts. Came up with a program, and as you know, the cost of care in Massachusetts is the highest per capita in the country. Obama decided to take that program, not recognizing what had been done. What angers me the most is this is a problem. We pay 2.5 times what anybody else pays in the world, and our health care and our health status is not the best in the world. Republicans have been negligent in coming up with a good program.
I agree.
If you want to see this collapse, a lot of people are going to be hurt.
Yep,
we need to reform it, not let it collapse. You abolish it, there are going to be a lot of people hurt. So you better figure out a way to handle it when this happens.
Very good points.
And the 69, if you want to hear about that, just read it. $25 billion to start off with, and a board that is answerable to no one. You will not collapse because they can keep raising the taxes.
Thank you very much. Next question.
This question tends towards Ed. You being from Minnesota, are you aware of Citizens Council for Health Freedom?
Yes, Twyla Brace.
Yes.
She's terrific.
She has announced what's called the wedge. Are you familiar with that?
I'm not familiar. I have heard about it, but I'm not very familiar with it. Yeah.
It's a free market health program.
Yeah.
Where the doctors and the hospitals, all health care, is allowed to market their services in a way that benefits the individual. And all the decisions are made between the health provider and the health need.
That's right, because you don't have a third party interfering with it. Absolutely.
She announced it in Washington, D.C. She started the wedge. She's growing it where doctors and hospitals can do direct care and be directly paid by the patient. The very things you guys have been talking about.
That's right.
Is what she's doing with the wedge.
And she's been working on that since before Obamacare, by the way, just to let you know. She's been working on that for quite a while.
1 minute, so let's speed round through the last 3 questions.
Okay, really quick. In nonprofit world, there are what we will call open call health clinics. They are essentially, they cater to the very poor and people who cannot pay. To a really astonishing extent, they have achieved a lot of cost savings by essentially doing a la carte. People come in and they get what they need and then they leave. I remember listening to a couple of people in Jane Garcia La Clinica who went into this, we finally got health care, and then having to sit there and figure out that, oh yeah, this doesn't work. The Obamacare model is a disaster. The nonprofit model of providing the care as cheaply as possible and as openly and caringly as possible worked.
Yep.
she's back to that model and running like hell from Obamacare. I think that we need to see more of that. I think we need to talk to these people doing the clinics and talk to them about what they're doing that's actually working and providing really good health care to very poor people.
Okay.
Yep.
Sorry.
No, it's okay. Don't
That's
say
good.
sorry.
Yeah.
All right, we'll take one more and then we got to run.
So one of the pitfalls of any government program is that it creates dependence inherently. So at least theoretically, people are now dependent on Obamacare. How do we get people off of that dependence?
Well, first off, Obamacare hasn't been around that long. And so it's not like, at some point in time, we're going to have to talk about entitlements like Social Security and Medicare and stuff like that. That's a much bigger issue in those programs. This is just the 4th year of Obamacare. So, I mean, there'd be some transition. And like the other gentleman who was in the healthcare industry said, that you have to figure out, you have to work on how you're going to deal with those situations. But as conservatives, I think we believe that in the power of the individual. And certainly what we saw with welfare reform in 1996 is that when you retool these programs so that you are lifting people up rather than keeping them locked into systems, they will meet that challenge. And so I think 4 years into Obamacare, we're not talking about a lifetime of dependence yet. So I don't think it's really quite that kind of issue. There's going to be a transition, but I don't think you're talking about the same type of thing as if you're dealing with an entitlement program that had gone on for a few decades.
Okay, thank you very much. Enjoy the rest of your weekend.